SARS-related coronaviruses, very close to SARS. Some of them get into human cells in the lab. Some of them can cause SARS disease in humanized mouse models and are untreatable with therapeutic monoclonals, and you can't vaccinate against them with the vaccine. So these are a clear and present danger.
Yeah.
We've even found people with antibodies in Yunnan to SARS-related coronaviruses, so there's a human exposure.
Right.
We're now doing surveillance. We're just beginning another 5 years of work to look at cohorts in southern China to say, well, how frequent does this spillover happen, and is it associated with disease? Because I expect, just like Nipah in Bangladesh, there are dozens and dozens of small spillovers going on the planet any one time, which we just never see.
Sure. Yeah, they never amplify. There are a few cases, and they're just absorbed in the illness, the overall illness of the population, right?
Now, you could say, so who cares? You know, and that's one argument. But our strategy is any one of those could become pandemic. There's a lot of stochasticity in what happens then.
Yeah.
So if we look at all of them, understand patterns, try and reduce the number of spillover events we've got, you know.
But if you're saying these are diverse coronaviruses and you can't vaccinate against them, there are no antivirals, what do we do?
Well, so I think that coronaviruses are pretty good. I mean, you're a virologist, you know all this stuff, but you can manipulate them in the lab pretty easily. It's just spike protein drives a lot of what happens with the coronavirus, zoonotic risk. So you can get the sequence, you can build the protein, and we work with Ralph Barrick at UNC to do this. Insert it into a backbone of another virus, and do some work in the lab. So you can get more predictive when you find a sequence. You've got this diversity. Now, the logical progression for vaccines is if you're going to develop a vaccine for SARS, people are going to use pandemic SARS as
sure.
But let's try and insert some of these other related and get a better vaccine.
And I guess also knowledge of what's there. If you see something emerging, it give it a head start on making a vaccine or a therapeutic.
That's true, and you know, better knowledge of where they are as well, so that you can put your money into these clinics that matter. And that's one of the big things that we've been trying to push.